Welcome, everyone. Welcome to Evidence-Based Practices for Students with Autism. My name is Dr. Emajonite Etienne. I am the owner of Etienne Enrichment LLC. A little about me before we get started. I am a developmental interventionist and a former ABA therapist. I have over 13 years of experience working with children and adults with autism and developmental delays. I am fluent in Haitian Creole. Additionally, currently, I am a professor right now. I teach in the social sciences department at Essex County College, and I am a consultant with my company, Etienne Enrichment LLC. About my research, I defended my dissertation last year in March of 2023. My qualitative case study focused on teacher perceptions on the use of evidence-based practices for students with autism. During this presentation today, I will discuss some of my findings and recommendations as it relates to those who work with children with autism. The participants in my study did represent a sample of teachers in the state of New Jersey who worked with children with autism. Some recommendations for future research suggested some embedded professional developments to explore the evidence-based practices for students with autism. So thank you all for being here and helping me bring my research recommendations to life. During our session today, we will get some information about the importance of evidence-based practices for students with autism. We'll define the meaning of EBPs or evidence-based practices, and I will use them interchangeably during this session. We'll understand what research says regarding evidence-based practices for students with autism. We'll discuss implementation of evidence-based practices for students with autism, and we'll also discuss the usefulness of EBPs for students with autism. Currently, how many children have autism? 1 in 36 children in the US have been diagnosed with autism, which is up from the previous rate of 1 in 44. In the US, about 4 in 10 boys and 1 in 10 girls have autism. Boys are nearly 4 times more likely to be diagnosed with ASD or autism than girls. The changes in the demographics might reflect improved outreach screening of autism amongst different communities. Evidence-based practice is the idea that practices should be based on scientific evidence. An evidence-based practice is an instructional intervention or procedure or a set of procedures which researchers have provided an acceptable level of research that shows that practice produces positive outcomes for children or youth or adults with autism. The DSM defines autism spectrum disorders as persistent deficits in social communication and social interaction across contexts as manifested by the following: some concerns with social emotional reciprocity, sharing interests, initiating or reacting to normal social interactions. Some of these deficits may include using and understanding nonverbal communicative behaviors such as body language, eye contact, gestures, and facial expressions. Some additional difficulties could be developing and maintaining relationships, adapting behavior to changing social contexts, making friends, or lack of interest in peers. Also, restrictive, repetitive patterns of behavior, interests, or activities demonstrated by at least 2 of the following: stereotypical or repetitive motor movements, object use, or speech, instance on sameness, some inflexibility with regard to routines or ritualized patterns of behavior. Some additional characteristics of children with autism could be impaired social relationships, such as joint attention, as let's say somebody were to open the door and I'm working with a child, and then I turn and look at that child, but the child doesn't turn and share that same visual cue that I shared with the person walking in, that would be an example of joint attention. Communication and language deficits such as echolalia, repetitive, ritualistic, and unusual behavior patterns known as stereotypy, instance on sameness, some unusual responsiveness to sensory stimuli, and executive functioning deficits, which could mean regulating one's own behavior. Some additional characteristics are extreme aloofness, social situation difficulties attributed to deficits in theory of mind, some deficits in joint attention. Some children with autism do not speak, and some children with autism can be verbal or are verbal. Echolalia is common amongst those who do talk. Concrete or literal processing of verbal information is common. Some children will exhibit stereotypy, which is a pattern of persistent and repetitive behaviors. Children with autism are also sometimes inflexible in routines. 70 to 80% of individuals with autism may react atypically to sensory stimulation. Some children may exhibit an over or an under responsiveness of sensory stimuli. There are 3 levels of autism. We can see autism level 1, autism level 2, and autism level 3, and I will break these down. So autism level 1, children in this level will require some support, may have difficulty initiating social interactions, organization and planning problems can hamper independence. Children at autism level 2 often have high interest in specific topics. Children at the level 3 are considered high needs, will engage in many repetitive behaviors, and may need substantial supports throughout life. Why is my study important? So my study is important because studies have indicated that in order to experience academic, behavioral, and social gains in the classroom or community or at home, it is important to implement scientific and evidence-based interventions in the natural environment where problem behaviors might occur, as stated by Watkins et al. 2019. Therefore, it's the educator's responsibility to identify and use effective instructional practices specific to the needs of students with ASD or autism and is associated with their educational success. I just wanted to add that there is nothing definitive in the literature regarding the achievement gap for students with autism, but studies persistently reported that underachievement may vary where the student is on the spectrum. So it's important that educators use effective educational practices to meet the needs of students with autism. So my study was guided by Prochaska and Veliser's trans-theoretical model of change, the trans-theoretical model of organizational change, which describes the process of implementing change in an individual's behavior. The TTM framework, or the trans-theoretical model of organizational change, identifies 5 stages to behavior change. So these 5 stages are the pre-contemplation stage, the contemplation stage, the preparation stage, the action, and the maintenance stage. The TTM framework has been suggested as a strong framework to help us understand the implementation of EBPs because it relates to the belief that making the change to using an EBP can improve the students' academic outcomes, or the classroom environment may make teachers more likely to use the EBP. So on the screen here, we just see a breakdown of the cycle of change that I used in my study. So looking at the stages of change in another way, so the pre-contemplation stage could be that beginner stage where there's some concerns, we're not sure if there's no concerns, but we may need more findings, more data, more observations to see what exactly needs to be changed or where the problem is. So for the contemplation stage, we can think of this as a maybe stage. For the preparation stage, once we've decided that maybe this student with autism has a behavior concern that we can try to target, we prepare and we plan for that. The action stage is where we're actually implementing that intervention, which we'll discuss later on for students with autism. And the maintenance stage is where we're progress monitoring, we're seeing if we should keep going or should we circle back to the pre-contemplation stage and to do this over. So in my work in early intervention, working with children with autism as an ABA therapist, observations were very important, and I sort of found myself implementing these stages even before I was deciding that I wanted to study this for my research. So collecting data, observing, and that goes through this process. So my research questions that I came up with during my research was, what evidence-based practices do elementary teachers report using when teaching students with autism in an inclusive classroom? Research question 2, how do teachers perceive the effectiveness of evidence-based practices utilized in the classroom when instructing students with autism spectrum disorder? Research question 3, how do teachers describe their decision-making when selecting an evidence-based practice for use in the classroom when instructing students with autism spectrum disorder? So my findings for my study, for research question 1, findings were participants reported that their experiences range from teaching students with ASD in both inclusive and self-contained settings to teaching students with communication impairments and students with behavioral concerns. For research question 2, the findings of this were visual support, positive reinforcement, and discrete trial teachings were the evidence-based practices that participants reported to using the most. During my study, a lot of practices and strategies came up, but after analyzing the data, these were the top 3 that teachers did report using. All participants believed that visual supports were a necessary EBP for students with autism. And again, EBP is evidence-based practice that I am using this term interchangeably. For research question 3, participants reported to meeting their children where they were in order to decide which EBP to implement to best fit their students' need. Participants also reported that using the child's IEP to help guide the decision-making process for EBP implementations. So some commonly used EBPs or evidence-based practices for students with autism are listed here. We will focus on 3 for the purpose of today's presentation. So the first one is visual supports, positive reinforcement, discrete trial, applied behavioral analysis or ABA, prompting, naturalistic instruction, modeling, task analysis, antecedent-based interventions, and social narratives. So participants in my study discussed using a variety of these strategies, but the 3 that I have highlighted are the ones that we'll focus on, which are visual supports, positive reinforcement, and discrete trial. So there's a guide by Sam et al. 2020, which was published in the Journal of Autism and Developmental Disorders. This guide shows the basics, planning, and uses and how we can monitor progress for EBP implementation. So lesson 1 of this guide, and you can go and find the study on your own. Lesson 1 of this guide discusses the EBP basics. Lesson 2 is planning for the EBP. Lesson 3 is using the EBP, and lesson 4 is monitoring progress. And if we can think back to the slide where I discussed my framework, it's kind of aligns to the phases of this for EBP implementation. So first, EBP that was discussed in my research was visual supports for children with ASD. So visual supports can play a crucial role in enhancing communication for children with autism, reducing anxiety, and promoting independence and understanding for children with ASD. These tools can contribute to a supportive and inclusive environment, fostering the overall development of individuals on the autism spectrum. So on the screen here, I just added two examples or samples that I found that I have used also, which is a first then, which is a visual support that is used to help children with autism follow directions, know what's coming next in their schedule. If they request something preferred, a teacher could tell them first clean up, then we get this. So for the first then board that's on the screen there, I believe this teacher is asking this student to first clean up and then you can play on the computer. So these are like pictures that are normally used for children with autism, children with communication concerns. So these pictures kind of show them what's expected. And sometimes these photos are made with actual real images of the child performing that task, just to give them an easier context to it. So visual supports for children with ASD. Visual supports gives children with ASD reminders of expectations. So in some classrooms, we may see a rules chart, but in a classroom that services children with autism, the rule chart could be different. It could be something motivational. It could have pictures on it. It can be more cues that'll make it easier for that child to understand. Visual supports help with problem solving. Again, like the first then, we need to clean up, then we can earn something. So what is the problem? Whatever that demand is that the teacher or the therapist places on the child. Visual supports help with communication needs. Many children with autism who may be pre-verbal or non-speaking or non-verbal, they may need a communication board or a communication device which will help demand or request for something that they may need. So visual supports are a highly preferred tool to help children communicate. Visual supports gives a cue of what to do or what is happening. Some children I have worked with, we use a visual schedule for them, basically highlighting everything that's going on in their day on a picture and time basis. So these are some of the benefits of using visual supports for children with autism. So positive reinforcement for children with ASD. Children can focus on learning and developing their skills without fear or anxiety by avoiding punitive measures, enhancing self-esteem, and having a positive attitude towards learning by the use of teachers or parents or therapists, related service providers using positive reinforcement. So positive reinforcement in definition is a response that is followed by the presentation of a stimulus that results in similar responses occurring more often. So a general example of positive reinforcement, we're a hard worker, our boss comes and gives us a bonus or a raise or a high five, praise, accolades, money. And what does that motivate us to do? Keep working hard, keep showing up, keep being that stellar employee. So that's sort of an example of positive reinforcement, something being added, and it increases the likelihood of that behavior happening again. Positive reinforcement is the process of recognizing, rewarding, and encouraging desired behaviors. For children with ASD, positive reinforcement can help with verbal communication, nonverbal communication, social interactions, academic performance, functional life skills, adaptive learning skills, and gives children with immediate feedback of desired behaviors. So on the slide here, this is a token board that I normally use for children with autism. So the 4 pictures up top reminds them of their rules. So at the beginning of a session, I will take out this token board. What's our rules? Quiet hands, quiet voice. I'm doing my work and I'm sitting nicely. So let's say the child is working to earn their iPad. So I would put a PEX picture of the iPad in that blank spot that says I'm working for, and then you would see a picture of an iPad. So I need 5 tokens to earn that iPad. So during my sessions, depending on how fast or slow or energetic this session is going, I would also follow the child's cue. So if they really need to earn this iPad time, I would kind of allow them to earn the tokens faster. If we're working and we're doing object ID, nice job keeping your hands quiet. Good looking. Here's a token. And then let's say we keep working again, touch cat, touch dog. Again, they earn another token. So I would speed up this session, and when they get to their 5 tokens, I'd remind them, good job following your rules. You earned iPad. And of course, it would be time-based. Let's say they're earning the iPad for 5 minutes or 10 minutes. Put a timer on. Once the 5 minutes goes off, okay, my turn, iPad's all done. And sometimes I'll even give them the start of that next phase of tokens just for giving up that iPad so easily, because depending on the client or the child I'm working with, transitions could be difficult. So positive reinforcement lets the child know, especially with using the token board, which is also a visual support, but can be used for positive reinforcement. It signals that that earning is coming and when it's coming. The last evidence-based practice that we will focus and discuss is discrete trial. So discrete trial teaching is a widely used teaching method in applied behavioral analysis, or ABA, for individuals with autism. It involves breaking down complex skills into smaller, more manageable parts and teaching them systematically, teaching students with autism systematically. DTT, or discrete trial, provides a structured and systematic approach for teaching, which is often beneficial for individuals with ASD who thrive on routine and predictability. The structured nature of DTT helps create a clear and organized learning environment. So discrete trial teaching for students with ASD can involve a response occurring when an opportunity to respond exists, occurs normally in a one-on-one environment or a small group, fosters learning through repetition, I call it like more repeated exposure, maintains consistency in teaching, aids in data collection, and DTT systematically teaches a skill. So let's say we're working on a social skill, like saying hi. I would sort of contrive the environment where I would walk around with a index card, and I'll use a bold permanent marker, and I'll put say hi to, let's say, Emma. My name is Emma. Say hi to Emma. So the student I'm with, whoever's coming onto us will see my index card, and I'm sort of setting it up and making sure they say hi. Hi, Emma. So every time the student responds, of course, that's a plus for that trial. So I would make this trial happen 10 times, which is normally a discrete trial cycle, often occurs 10 times, just so the data's out of 100. So let's say this child said hi to 8 people or 8 trials. Out of those 10, it would be an 80% response rate for that trial. And then we would see if the child mastered this skill over maybe 3 days or a week. And that's sort of an example of how discrete trial would occur. So that repeated exposure, it's happening in real time, although sometimes we need to set up the environment for it to happen. And sometimes it'll happen spontaneously, but that's how we would do discrete trial. That's just one example. So making the school community or after school setting more inclusive with using some of the strategies that we discussed here today, we can incorporate program modifications that allow the child with autism to share activities and experiences with other participants. We can interact, teach, and engage through the child's fascination, like positive reinforcement, visual supports, using those supports that has interests of that child. We can have a sensory room or cozy corner to help for regulation, and we can support expectations, transitions, and routines by the use of visual supports. So using evidence-based practices or EBPs in the education and intervention for students with autism spectrum disorder is essential for promoting effective and meaningful outcomes. EBPs are interventions and teaching methods that have been rigorously researched and demonstrated to be effective through scientific studies. Using such practices increases the likelihood of positive outcomes for students with ASD. So where do we go from here? Programming for students with ASD should include a variety of procedures to help acquire and generalize new skills. Treatments, strategies, and practices for learners or students with ASD should be based on a review of scientific evidence for implementation, effectiveness, and fidelity. And before we end today, I would like to leave you with this quote by Dr. Ivar Lovaas. If they can't learn the way we teach, we can teach the way they learn, meaning meeting children with autism where they are is a strategy that one of my participants discussed when deciding which EBP to use. Yes, we want to support children with autism. We want to use evidence-based approaches, but finding ways to use these strategies to help children with autism thrive is the essential component of this session. I thank you for your time today and thank you for learning more about evidence-based practices for students with autism. Have a great day.